Hello and welcome back. I am Ashok Rajguru, your instructor, and we will continue with Case 8 from Dr. Borkar's book, Pathology Factor in Remedy Selection. The title of this case is A Case of Lupus Erythematosus or SLE. So first of all, we'll try to develop an understanding of what this particular term means. The objectives of this lesson or this video is to understand what is the diagnostic criteria of systemic erythematosus lupus. We will also see what are the common symptoms that a patient will present when he has been or she has been diagnosed with this particular condition. Also in this video, we will talk briefly about what are the tests that are used to diagnose this and what are the limitations of these tests, or what is the predictive value of these tests. And this will bring us to the important theme of the importance of the homeopathic perspective in every case. As you'll shortly see that just putting a label of a disease name will not suffice to heal or cure the patient. Now, what exactly is systemic lupus erythematosus? Let us take each one of these terms one by one. The word systemic means that it is one that affects a number of tissues, or it affects the whole body. For example, diabetes is a systemic disease as it affects the whole body. Similarly, if you have arthritis, it is also a systemic disease because it affects a large number of tissues at different times as the disease progresses. So this is one important thing to understand, that if we are going to label any disease as a systemic disease, it has to affect a number of tissues or the whole body as a whole. Now, lupus is the name given to a disease that causes ulceration of the skin. That is very important. Lupus is a Latin word for wolf, and apparently it has been chosen because it devours the affected part. It's a pretty aggressive disease, very painful. Another version of the etymology of this particular word is that patients present with a very distinctive butterfly rash on their face. It's mostly symmetrical, and that resembles the bite marks of a wolf attack. So this is information that you can just keep in your mind in order to understand the derivation of the word lupus. And then the third word of this particular disorder is erythematosus. Now this comes from a Latin word or a Latin root and a Greek word which means reddening. So the redness is one of the important features of the presenting complaints. Please keep this in mind when we look at this case from that perspective. This condition was first described by a French dermatologist. So once again, there's a very strong affinity with the skin back in 1828. And the father of the modern medicine, Sir William Osler, he had identified that this is not just a local skin problem. It is in fact a systemic disease which can affect many tissues or the whole body as such. Now, you must have heard about the ICD manual, and the current issue is the ICD-10, and the acronym ICD stands for the International Classification of Disease according to the World Health Organization, which is a United Nations body. This particular manual describes or gives a description of this disease as a chronic, relapsing, inflammatory, and often febrile multisystemic disorder of the connective tissue, characterized principally by involvement of the skin, joints, kidneys, and serosal membranes. So anywhere you have the serous membrane, you are likely to have an association with SLE. It is of unknown etiology, but it is thought to represent a failure of the regulatory mechanism of the autoimmune system. So that's a very general term because Statistics tell us that 1 out of every 5 person is affected in some way or the other by an autoimmune disorder. Further, this disease is marked by a wide range of symptom dysfunctions and an elevated erythrocyte sedimentation rate. So this is an important factor to note, because if the patient is coming to you with some pathological laboratory findings, it should include this particular test on the blood and the formation of LE cells in the blood or bone marrow. So these are important things to keep in mind when you are dealing with the term or the name of this particular disease. Now, this particular graphic is taken from a nursing education website, and it describes the presenting symptoms as they would appear when the patient first comes to you. One thing is, of course, the butterfly rash over the cheeks, which is very predominant. You could also see these rashes on areas exposed to sunlight. That's very important, because obviously it means that sunlight aggravates the situation. So there is a lot of photosensitivity involved. Also, being a systemic disorder, you could have complaints of the kidney. So maybe the tests of the urine, which point towards the protein urea, would help, and that is something to keep in mind. Also, it could affect the heart, pericarditis, or vascular inflammation. The patient could show weight loss, fatigue, fever, arthritis, emotional liability, blood disorders, and neurological disorders. And it could also have an effect on the pleura, the pleural cavity of the lungs. And the patient could also present with cough or tachypnea, a problem with the breathing. Now, in order to diagnose this particular disorder, SLE, the American Rheumatological Association says that there is no single laboratory test that can determine if a person has lupus. Many symptoms of lupus are similar to those of other diseases, which is natural, because if it is a systemic disease, obviously you will be able to see many symptoms spread all around the body and showing or imitating each other to some extent or the other. It often takes many years for diagnosis to be made. That means it has got a slow onset. The American College of Rheumatology has developed a 11-point criteria for determining if a person is having this condition. According to the guidelines of the American College of Rheumatology, a person must present at least 4 out of these 11 criteria specified by this college. Now, one of these tests is known as an anti-nuclear antibody titer, the ANA test. So an anti-nuclear antibody titer, it should be obtained only in patients with unexplained involvement of 2 or more organ systems. So don't jump the gun, don't send a patient straight away for this particular test, because as we'll see later, it can have misleading, it can mislead. Now let us see what that 4 by 11 criteria is. Let's see what those 11 points have been mentioned by the American College of Rheumatologists. Butterfly shaped rash across the cheeks and nose. A discoid rash, that means raised patches. Skin rash due to unusual reaction to sunlight. Mouth or nose ulcers, which are usually painless. Arthritis of the non-erosive kind of 2 or more joints, not just one single joint, at least 2 or more joints with tenderness, swelling, or effusion. You could have cardiopulmonary symptoms as well, related to the heart or the lungs. There could be neurological disorders like seizures and or psychosis. Kidney disorders, a blood disorder like anemia, a low white blood cell or platelet count. Immunological disorders like antibodies to double-stranded DNA, etc. And anti-nuclear antibodies, the ANA, a test if it is positive in the absence of certain drugs which are known to induce this particular condition. So these are the 11 criteria, and if a patient qualifies 4 out of these, in that case we can say that the person is likely to have SLE. Now let's see how it applies to this case. Does the patient present with butterfly shaped rash? No. Raised red patches? No. A skin rash due to unusual reaction to sunlight? No. Mouth ulcers? Not reported. Arthritis of 2 or more joints with tenderness, swelling or effusion? No. Cardiopulmonary. The patient, she is not complaining of any pericarditis, but there is an aggravation when she takes a deep breath. So maybe there is something going on in the pleura of the lungs. So we'll retain this particular condition. Neurological disorders like seizures? No. No kidney disorders. No blood disorders as reported by the tests. There is no other antibody test that has been done to determine an immunological disorder, but indeed the anti-nuclear antibody, the ANA test, has tested positive. So we'll keep these two. So that means the patient is only presenting with 2 out of 11 of these features which have been considered to be important by the American College of Rheumatologists. Now let us see what the American Family Physician journal has to guide us. What it says is that if the titer is less than this particular ratio, that is 1:40, then there is a strong argument against SLE. In our case, of course, the ratio is much higher. So we will retain this condition and see what are the guidelines that have been provided by this particular publication. It says here that if the titer is more than 1:40, in that case, you can consider referral to a rheumatologist for a full SLE evaluation, that 4/11 criteria. If it is between 0 to 3, in our case it is 2 out of 11, then there is no SLE or incomplete SLE. If it is 4 points out of 11 or more, then you can consider that to be SLE. So as you can see, while the title of this particular case number 8 is says that it is a case of systemic lupus erythematosus, apparently it is not according to the criteria that has been presented here by the American Family Physician and of course the American College of Rheumatologists. Another thing which is very important and we must understand as homeopaths is to understand the clinical utility of these tests. What exactly do these tests mean and how far can we rely on them before we stick a label of the disease to that particular condition? So there are 3 terms we are going to talk about. One is sensitivity of the test. The other one is specificity of the test. And the third term is a positive predictive value. Now, when we say sensitivity, what we mean is that it will correctly detect patients who do have a condition. In other words, if a test is having 100% sensitivity, it will recognize all patients with the disease by testing positive. Now, mind you, if you have a population of certain people who are testing positive, it doesn't mean that all 100% of them are having disease. All it says is that all those who are having disease will test positive. So just keep in mind this particular difference, which is of great importance. That brings us to the next term, specificity. This is the ability to correctly detect patients without a condition. That means if you are having a population of 100 people who go for the test, and those 100 are not having any disease, 100 healthy people, and when they are tested, 96% give a negative result, then we say it has got a 96% specificity. Just keep this in mind because we'll be discussing this when it comes to this particular case. The last term is the positive predictive value. This is the probability that subjects with a positive screening truly tests have this particular condition. That means going back to the sensitivity, if you are having say 100 people who are testing positive, we must also look at the positive predictive value to understand how many of them are having the probability that they actually have the disease. Now, if we come to the ANA test, we have come to know that its estimated sensitivity is 100% for SLE, which means it will recognize all those patients with a disease by testing positive. But if you take the specificity, the estimated specificity of the ANA test for SLE is only 86%, which means that if there were 100 people with no disease, 14 people will still test positive. That means if I have a random mix of people who are having the disease and not having the disease, out of them, there'll be a good number of people who will test positive without having the disease. So that could be a red herring and lead you astray. Apparently, this particular case could fit into this category because the patient is not presenting with 4 of the 11 symptoms which are normally considered to be associated with a condition which is described as SLE. Further, if we look at the positive predictive value of the ANA test, it is only 11% for SLE. In other words, even if I have a person presenting with a positive test, there is only an 11% probability that the person is having SLE. Not a very good or reliable test at all. So that once again emphasizes the importance of homeopathic case taking. These figures and numbers can be have been obtained from this paper, which is mentioned here. It's a wonderful paper, and I would recommend each one of you to please read that in greater detail and form a very clear concept of these 3 terms: a sensitivity of a test, the specificity of a test, and the positive predictive value of a test. Once again, positive predictive value is the probability that subjects with a positive screening test truly have the disease. Okay, now we go on to the next point. As far as the anti-nuclear antibody tests go, even if they test positive, they could also be relating to other diseases, not specifically SLE. 32% people will test positive in the general population at the 1:40 ratio, and 5% of the people at the 160 dilution ratio. Also, there are many other diseases like the Sjogren's syndrome. 68% of the affected people will test positive, scleroderma, rheumatoid arthritis, and juvenile rheumatoid arthritis. So it is not just a test for testing this, it's just testing one element which could be associated with many other diseases. That is why the concomitants or the comorbidities are so important when you are handling a case such as this. So I will just summarize the points that we have gone through. We developed an understanding of SLE classification as a disease. We looked at the ICD, which is a World Health Organization document. It gives a particular number to describe a specific disease. We saw the definition as per the ICD-10, the latest edition. Also, we saw what are the common symptoms of SLE. We also saw the value and limitation of tests. Also, please remember that the ANA test has its not just the limitations, but also it points to other diseases. And such tests are really warranted if the patient is presenting at least 4 out of the 11 symptoms mentioned. So please keep this in mind as we progress with the case. Thank you very much for your attention, and bye-bye.